Hi, and welcome back to the Birth Blueprint, where we'll be discussing birth and maternal health care. My name is Rosemary Ozuna, and I am the birth care coordinator of the Birth Center. In this episode, we'll be highlighting each and every podcast member. Our first member, Dr. Nicola Pemberton, owner and medical director of Artemis OBGYN and the Birth Center of New Jersey. Hi, Doc. How are you?
My name is Dr. Nicola Pemberton. I am the owner and the medical director for Artemis OBGYN and the Birth Center of New Jersey. I originally am a Brooklyn native, born and raised, and after moving to Florida, I also attended University of Miami for undergrad. I went an international route for medical school and attended St. George's University School of Medicine in Grenada, West Indies. During that time period, I had an opportunity to go to the United Kingdom to do my clinical rotations, for which I had a great opportunity to work with midwives and see midwifery model of care in action. Once I've completed my medical school studies, I came to New Jersey and completed my OBGYN residency at Newark Beth Israel Medical Center in Newark. And I've been in New Jersey ever since.
Wow. You're well-traveled, Doc. What made you what made you want to be an OBGYN?
I actually always wanted to be an OBGYN. Since I was 14 years old, I declared that's what I wanted to do for my life. And even though I didn't really know all that it entailed, I have to say that I've always wanted to deliver babies, and I'm actually doing that to this day. And for that, I consider myself living the dream. It's been a passion of mine. And despite some realities or some situations that could kind of make it a little bit more serious and maybe dim that fantasy, it's still, nothing's changed the fact that I'm still living my passion and my dream.
Awesome. Knowing you've been so well-traveled and you've worked with so many people, you as a resident, and once you graduated, what was your vision then and versus what your vision is now? And what's the difference?
Well, when you say vision, you mean for being an OBGYN or for the specialty?
Vision, I think I'm asking vision. How did you see yourself back then? Graduating, what did you think life was going to be as an OBGYN? And now knowing what you know,
Yes.
what is your vision going forward?
Okay, that's a great question. I would say when I first graduated from residency, my goal was to remain in education. I had really always desired to pass knowledge along. And continue to train people who are coming up in the field and hoping that they can continue to train others. I knew what I went through just to learn the information, to gain knowledge in the subject of OBGYN, and I really wanted other people to learn it the way I did and maybe be able to make it easy for learning and make it exciting and be able to explain it in ways that will allow people to appreciate what it's all about. But due to necessities in family, obligations, concerns, things like that, illnesses, it changed the course of my life when I went from being in an education position as a hospitalist when I was working in Brooklyn, New York, training residents, and then going into private practice. And even if it had been a necessity, I actually still enjoyed aspects of private practice when it came to interacting with patients. Having that one-on-one, sometimes laughing, joking, but using that background of education to be able to educate my patients on their bodies and what is involved when it comes to their care. So my vision for it now really hasn't changed. It just encompasses a more personal take, and doing so in private practice is just my way of being able to continue on the same.
And what are some of the hardest lessons you had to learn as a female doctor, and especially a woman of color?
Yes, I feel like it encompasses being as a woman and a proud Black woman. For me, it's no different when it comes to some of the challenges that I've had to deal with being a physician, and especially in the specialty. You think that as hard as you work to become a board certified OBGYN or to be able to obtain titles, you still find yourself not getting a seat at the table. You'll still find people will dismiss you, diminish you, and you just find your voice is sometimes not always heard, not always seen, always doubted, second guessed. And as a result, I think what I've realized in that situation, being even with all that I've achieved in the specialty, that a lot of my patients who come to me experience that on their own already, and that's without having studied and taken all this time, all these years to know OBGYN from the professional standpoint. So when I see that they're experiencing the same thing, where they're not being heard or seen, many times women and women of color, it allows me to be able to still try to amplify my voice and amplify enough for the both of us.
And I know I feel like you've worked with a lot of midwives. What made you choose that lane to work with midwives?
Well, it starts out, I guess you could say, from my grandmother. I am first generation West Indian American. My grandmother was from the Caribbean. And she was one of those go-to women on our home island, where what we would call in this country a granny midwife. She was that go-to person. She was the woman they would call to their births to help assist and attend their labor and their deliveries at home. And so I guess you could say things came full circle, coming and becoming an OBGYN, having the desire and the passion to deliver babies and being a part of women's labor and delivery. It just opened up that opportunity, going to the United Kingdom and working with midwives and being able to see midwifery as it was meant to be, made it seem like this should be more of a collaborative effort. Nothing antagonistic, not there, and I'm here. It is us all working together and showing and seeing how they perform labor, how they support the woman in lower situations, whereas I may come in and help when it comes to the higher situations. It just seemed like natural to be able to say we work with midwives. I know it's maybe not as common as it may be in the United States as it might have been overseas, but that's, you could say everything's coming full circle when it comes to that.
So you could have graduated and worked in a private office, but you opened your own office and didn't stop there. You opened a birth center. What drove you to do that?
I think a lot of the times women who go into this field, regardless of the level of professionalism from either physician, from midwife, doula, many times there are things that may drive us, whether it be things from our past, people in our lives, or our own personal experiences. Having children myself, I could see that we could do some work. And we can always improve when it comes to how we do things. And it's not as a means of diminishing hospitals and their roles, because they have their role. But there are always alternatives, healthier and safe alternatives, that don't have to be looked at as, off, but more just different. But they're not really. They're still within the realm of taking care of the patient. So when I opened the birth center, it was a need. There was clearly not that level of options for women to be able to say, I can have a stake in what I would like to say when it comes to my birth, having autonomy when it comes to where I want to birth, if I'm low risk enough to birth there. And so having had the opportunity, and granted it was far from easy doing it, but the need was there, and if we had to die trying, I was going to try to see what we can do to open a space that women would feel safe regardless of who they are, black and brown, women of all types, of all kinds, of all races, of backgrounds, languages, and be able to say I have a choice in the matter. If I am eligible for a birth center birth, I would like to have one. And so that was the purpose, was being able to open one in the community where people can be able to have those options.
And we appreciate you taking that risk of opening a birth center in such a diverse area. Thank you, Dr. Pemberton. Appreciate you.
Appreciate you.
Our next podcast member, Chidera Chima, certified nurse midwife of Artemis OBGYN and the Birth Center of New Jersey. Hi. Chidira, how are you?
I'm well. How are you?
Good. So I had a couple of questions for you. I wanted to know more about you and your background. Tell me more about yourself.
What exactly do you want to know?
Where are you from?
Okay, I'm from Jersey, born and raised.
Okay.
Background, I'm first generation Nigerian American. So that's a little thing to know about me. I'm one of three.
A little birdie told me that you have a sister.
I do. I have a twin sister.
Aw.
I'm older.
Oh, by how long?
4 minutes.
Oh, so you really
It
older.
matters.
It matters.
It matters.
It does.
Yes. I have a twin sister, which is a fun fact about me.
Yeah. And what made you become a midwife? What chose you? What made you choose that field?
Midwifery. It was kind of non-traditional. I mean, I come from a long family of nurses, so naturally I didn't want to be one. And then I found my way here. I did a mission trip to Ghana, West Africa, where I met a few midwives there. We were doing like a women's health initiative and kind of learned more about what they do, and it kind of sparked my interest to kind of basically reroute my whole career.
Wow.
Yeah, so
How was that experience?
life-changing.
Really?
Yes, it was. It was a very good experience.
So, Shadira, what is a midwife? And why is it talked about so much more nowadays versus back when that was basically most of your medical providers back then?
Well, short answer, midwife just means to be with women. It's basically a provider who stands with women before pregnancy, during pregnancy, and after. We kind of work with you throughout to help educate, prepare, nurture you through the whole process. As far as why it's talked about more, I would just say in this day and age, a lot more women are becoming more aware of their autonomy when it comes to birth and what they can do, because, you know, historically a lot of people just kind of stuck to the whole this is what you're supposed to do just because someone else did it. And with that, midwives kind of aid in nurturing and kind of giving you, you know, autonomy to basically birth and labor how you choose, of course in a safe manner. And then
And what are some of the challenges you face as a midwife, and especially a midwife of color?
Good question. In my short career so far, I would say just systemic challenges of trying to bridge the gap between, like, you know, in-hospital care and just what most providers are used to doing when dealing with women in labor, trying to show alternatives as far as working with lower risk women, different things that just aren't the norm, trying to get hospitals out of the whole this is how it's always been done, and showing them there are alternative ways to still get the outcome of a safe delivery and a safe mom and baby. So trying to break that barrier to kind of show them different ways that things can be achieved is one of them.
Okay. And so I know you were a nurse before you became a midwife. What do you feel is the difference when you were a labor and delivery nurse versus a midwife now? Now knowing a lot more than you did when you were a registered nurse.
I don't really think there's a difference. Other than knowing more on the provider side, right? As a nurse, you kind of just we're always with the woman, and you're kind of taking orders based on the provider and just, you know, having them deal with the latter. But as far as being a midwife, we're still with our patients. We're still kind of counseling them and cheering them on in that way. So it's like more responsibility, but you're still encompassing the labor and delivery side where you're still, you know, making sure that your patient is okay, even mentally, physically, just kind of nurturing them and making sure that they're where they should be.
Awesome. So since you were a labor and delivery nurse and now being a midwife, what do you feel is the difference between working at a hospital and working as a midwife in a birth center? And how do you feel about working in a birth center?
I feel like it's helped calm me in a way. Being a labor and delivery nurse, you're just very on go a lot. You're always taught of what could be or the extent of how bad things can get, so you're always on high alert. And having the birth center experience has kind of helped calm me in ways to notice things that are just normal ways of that labor progresses, normal things that happen, and kind of take a step back to evaluate the whole situation without just trying to intervene at all times. It's funny, we had a situation a few days back with a patient where everyone around me was kind of going very crazy. And I'm just like, this is normal labor, it's a normal process. Although it happened in a hospital setting, I kind of had the birth center mindset that things are progressing how they should. And if everyone's calm, it helps calm the mother. And I feel like being that supportive background to the patient and their family kind of helps ease them and things flow. And that kind of something that I've learned from working in a birth center setting, that, labor is normal and things progress as normal as they should if you just let them flow. So it has kind of added that to my repertoire, which I appreciate.
Thank you, Chidera, and I appreciate all your time
Thank
and
you.
all the information I got from you. Thank you, girl.
Thanks.
Our next podcast member, Michelle Gabriel Caldwell, doula director and resident instructor of the Birth Center of New Jersey. Hi, Michelle. How are you?
Hey, Rose.
How's everything going?
Awesome.
Awesome. So I have a couple of questions for you also. I want to learn more about you. Tell me about you. Give me a little background so that people know who you are, where you come from, and all that jazz.
Okay. Interesting that you say all that jazz because I'm originally from New Orleans.
Oh, nice.
And yes, my handle's Creole Jersey girl, so I kind of like to infuse, that background. Raised in Jersey, and but I went to college in New Orleans. So went to Xavier University, undergrad chemistry, and then came back to Jersey for all of the advanced degrees in chemical engineering and NJIT.
So you're a chemical engineer.
Yes.
And you are a doula director. So what made you choose to change your career and lifestyle into becoming a doula?
Well, I didn't change it. I added it on.
Oh, okay, awesome.
Yes, so I am still a chemical engineer and I'm still doing that full time.
Okay.
But I just added on all the other maternal wellness and health information because I needed to. After having my own children, it was abundantly clear that Black and brown bodies did not know enough about birth and needed more information. It prompted me to become a childbirth educator first.
Okay.
So in that work was a lot of training and providing information to anyone who would listen about how to birth, what their options would be, how to be empowered, how to reduce trauma. As much as I could, pour myself into individuals. And my husband actually trained and studied with me as well. And so we did sort of like couples classes that sometimes turned into couples therapy, but it really did work out nicely. And I didn't become a doula per se until one of my childbirth education students called me up to attend her birth. I had dual certification as a childbirth educator and a doula. Didn't think I was ever going to use it until that day.
Nice. And then you realized that was kind of a bit of a calling?
I realized it was completely needed, and I had to sort of pivot a little bit to work both ends of education and attending the births.
Now, if you can enlighten me a little bit, what is a doula?
A doula is not a medical professional, but a doula is a birth professional. So I have years of training and understanding of normal, natural, physiologic birth, every single intervention that can be laid on a person during that time, and really supporting and thinking about how I'm going to help them not only advocate for themselves, but assist them in advocacy and amplifying their voice.
Awesome. And why are doulas so important?
Because we're amazing. No.
Well, that, of course.
Because we're honestly providing information, emotional support, and physical support. So really helping this person get into labor with comfort measures, making it a little bit easier for them, regardless of the type of birth that they want, right? So even if they choose to have an epidural, it's still important to understand what positions are necessary to get that baby out. Also to work with families who are choosing surgical birth or need surgical birth. Support, emotional support, information support is critical to really helping that person, that family, evolve into the next phase of parenthood.
So a doula is necessary in any type of birth you have, even if it's a natural birth or a C-section, a doula is needed in either or.
I think a doula is critical probably in more heightened situations as well, because there is, a lot more emotion tied to emergency situations, and calm and centering and focus and knowledge, informed consent. All of those things need to be present in that space. But obviously it's always interesting to be able to pivot, because everybody can start off wanting a specific type of birth, but you have to know what to do when things change.
And I'm going to just refer to when you were talking about education earlier. What type of education do you feel you need to, as a doula, patients need to know? Just because I feel like there's a lot of different classes people take, and I would like our viewers to know the best class that they should be taking.
I think taking a comprehensive childbirth education course is pretty paramount. It provides all of the information that sometimes isn't always given at every single prenatal appointment, right? So our doctors, our midwives are kind of busy, and those appointments usually aren't as long as they would like them to be. And so really kind of pulling all of that information at one place, and then be able to help them go to their prenatal visits and ask the right questions and get the information that they need from their provider. But it would kind of entail the basics, right? Understanding physiologic birth, what's physically going to be happening during the labor. What does it mean to be dilated? What does it mean to be effaced? What does it mean to get into different stages of labor and things like that. In addition to, again, going back to informed consent, understanding what happens in the event of an emergency. What is a true emergency? How to really pivot, and along with having realistic expectations about things too, it just provides people with an abundance of information that it would take them months to get from Google, if you're actually going to get it from Google, and one place for a professional to be helping them answer those questions.
And as a doula, are you just there for the labor and birth, or how often would I see you? If I was a patient, am I only going to see you during labor?
No. So a doula typically sets up a relationship prior to, and with a minimum of at least 2 visits, where there's discussion about the birth plan, maybe even coming to the home to talk about how laboring is going to happen, providing information about when labor, when to actually move into your birth space, and then we're there from active labor to immediate postpartum. So ensuring that everybody's happy and safe and healthy, and mom and baby have transitioned well. And then we do continuous support postpartum. So that could be in the hospital if they wanted it to be, or that can be more visits up until the baby is about 6 to 8 weeks old.
Awesome. And last question. During postpartum, are doulas, do you have doulas who are also supportive throughout postpartum?
Yes. So there are birth doulas, postpartum doulas, fertility doulas, bereavement doulas,
Wow.
divorce doulas. There are doulas for every phase and every part of your life.
Oh, wow.
And so understanding that, if there's a person who's going to be the birth doula, I've just described to you the extent of that focus. Hiring a postpartum doula, that person can be with you and your family until the baby's 2 to 3 years old.
Wow. Oh, nice. Since you talked about education, what classes do you offer and where do you offer these classes?
I offer a lot of different courses. My own holistic childbirth education course, which is 4 weeks long at the Birth Center of New Jersey. And I think it is a wonderful introduction to families to be able to not only understand birth, get a little bit of information about how to prepare for their birth, in addition to support for a touch of breastfeeding and some newborn care information. And then in addition, I'm also a doula trainer. So
so you train doulas?
I train individuals to be a doula as well. So I'm teaching fertility doula training, birth doula training, and postpartum doula training.
Oh, man.
And I also do that here at the Birth Center of New Jersey.
Awesome. So you said they were 4 weeks long. Are they like 4 weeks consecutive every day, or is it like one
No,
specific?
I like to say 4 weeks because I want people to understand the commitment level. But it is definitely once every Saturday for about 2 hours.
And they're like series classes, so you must attend for all 4 classes, which gives you the overall?
Every single course or every single class is different topic. So it's not like I can go to 2 of 3 of them and and get all the information. Every single one would be unique.
At what point should I be attending these classes?
I love this question. Because I think it's so important to start as early as possible. And I understand time is, gets away from people, but for me, I think 24 weeks gestation should be like the time you start thinking about getting into a childbirth education class.
Okay. All right. Awesome. I appreciate that. Nice. Well, thank you so much, Michelle, and I appreciate all your time. It was a pleasure talking to you. And
You're welcome. It's always nice to talk to you, Rose.
yay.